Hi everyone, I'm Kim. I'm very glad to see you again at the film, and I really hope your safety from COVID-19. Today I would like to introduce my ordinary digital dentistry life. So when I talk about my ordinary digital dentistry life, I always emphasize about the fully digitalized virtual patient. The reason why I use the virtual patient is I can act as the conductor. It means through the virtual patient, I can interpret every situation of the patient. And then I send the data to my lab technician. And after that, I ask for my lab technician which I want everything. For example, diagnostic wax-up, surgical stent, and provisional restoration and final restoration, sometimes orthodontic arrangement, and jaw stabilizer, some things. So today, let me introduce how we can act as the conductor in our daily practice, use digital technologies. This patient came from the China, and as you can see in this picture and video, her dentition has some problem. But unfortunately, she asked for me these four things. The first one, she wanna wear arrange the dentition, and second one, she was the Chinese entertainer, so she wanna very white tooth. That is very easy things, and she never wanted to receive the surgery. It means periodontal surgery. And she had to go back 3 days later. Anyway, we have to solve these problems. Problem is this. This kinds of the case, how we can confidentially cut up the patient tooth. For solving these problems, think about that. If we have these three kind of the things, it means first one is the diagnostic wax-up, and second one is the provisional restoration, and third one is the preparation guide. Before you prepare the tooth, if you have these three kind of the things, we can confidentially cut up the patient tooth like this. Preparation it. And through the prep guide, we can check the prep amount and we can correct it. And after that, put in a provisional restorations. Through this procedure and use a digital milling machines, after 2 days, I put in a very ultra white IMAX crowns. Anyway, after that, she was so satisfied about the result and go back to the China. After finish the deprogramming, fortunately, this patient jaw position is very stable. It was very lucky. And go to the next step. Through the large FOVC VCT, I can obtain a whole information of the patient head and skulls and define a center of the face. And when I analyze the patient's skeletal pattern and soft tissue profiles, fortunately it was the normal. Don't worry about it. If you can able to use AltoGate software, you can easily analyze the patient's skeletal patterns. Today, because of the time limitation, I cannot explain detailedly. And after that, decide the maxillary central incisor position. Instead of the two-dimensional image in our AutoGate software, you can use the three-dimensional tooth library. So, use this three-dimensional library, you can decide and you can fix, you can move your future anterior maxillary central incisor position. And after that, put out this data. And based upon that position, my lab technician drew the full arch diagnostic wax-up. This is the future image, and based upon it, anytime you can put out the restoration. Not only provisional restoration, but also when you make the final restoration, you can use these CAD design files. So I put out the PMMA provisional restoration and immediately change the starting point. I called this is the new starting point. As you can see in these pictures, it looks like the final restoration status. So through this new starting point, we have to make the re-evaluation. And this provisional restoration make the change patient emotion. Finally, this patient can smile. And after checking all of the situation, just change the material. As I mentioned before, as we know well, this patient has some acid problems. So, in this case, I use the monolithic zirconia crowns. So, whole of the procedure is very simple. Analysis and make the new starting point, and through the new starting point, make the re-evaluation. And if your re-evaluation sign says the OK, go to the final restoration. So one of the best merits of the digital technology is we can make the proper diagnosis, and through the digital, we can easily and very quickly change the new starting point. Let me show you another case. This middle-aged woman lost her smile. It looks very complex. Even though it looks so complex, don't worry about it. Make the virtual patient and design a new smile. And based upon your new smile, my lab technician drew the full X-ups. I called this is the final goal. And based upon this final goal and the present illness, we can make the treatment planning. In this case, patient really want to change very quickly. So we decide the implant surgery. So based upon the diagnostic X-up, I placed the whole implant like this. But in this situation, I have to place implant almost the same as this situation. One of the best way is use a guide. That's why I always use the guide surgery. And place some of the implants where I can do the immediate loading. Through this immediate loading, I can recover the patient function and aesthetics, minimal patient function and aesthetics. And after that, check the patient emotion. Patient smile is totally changing. And then put in a CAD-CAM zirconia hybrid abutment and put in a provisional restoration and check all of the situation. All of the situation means occlusion status, speech, tissue response, aesthetics. And if this provisional restoration shows the good signs, just change the material and we can finish the case. And I used the monolithic zirconia crown over 10 years. So in my opinion, zirconia is very tissue-friendly material, but it is too hard. So especially in a full mouth reconstruction case, there is no stress breaking area. So when you use the monolithic zirconia crown, you have to care about the patient function and occlusal adjustment. So in my case, when I use the monolithic crown upper and lower jaw, at the time, I always use the protection splint. And 1 week later, I check the surface of the protection splint. Can you see the scratch over here and here? It means this patient has the some part functions. How about 1 year later? Intraoral view, it looks good. But when I check the protection splint, you can see the huge amount of the crunching and grind signs. It means this patient has the part function. But even though patient has the part function, we have to make the functional prosthesis. But in an analog era, when we make the functional prosthesis, we have to use a baseball and articulator mounting some things. It was very complex, very difficult. That's why a lot of the dentists don't like to use the baseball transfer and mounting procedures. But in a digital era, we can easily use the articulator in a virtual space. So, as you know well, in my practice, I use the huge large FOB CBCT. So what is the baseball? Match the patient hinge and articulator hinge. That is the basic concept of the articulator. So through the CT image, we can easily find the hinge axis and matching the virtual articulator hinge into the real hinge. This is the baseball transfer. So without the real baseball transfer, we can easily transfer the patient maxilla and condyle position relationships. And after that, I put out the articulator and I put out the occlusal plane and I put out the maxillary arch position. This is the mounting status. I send this data to my lab technician and my lab technician matching this virtual information into the virtual articulator. This is the cable articulator, and if you put in some numbers, we can make the dynamic occlusal status. It's an amazing era. And when I make the more precise prosthesis, I obtain a check bite. In the analog era, use a wax, we obtain a check bite. But in a digital era, through the intraoral scanner, we can obtain a check bite. So as you can see in these pictures, this is the protrusive movement check bite and scanning. Of course, at the time, you can use the intraoral scanner. This is the left side check bite. This is the right side check bite. After obtain a check bite, go to the CBCT. And based upon a CBCT, you can make the dot into the mesial pole and lateral pole like this. So these two dots means each condyle's mesial pole and lateral pole. Mesial pole and lateral poles. And after that, if you match this mandibular arch and condyle into the check bite, you can easily know the condylar movement and anterior guidance movement. And measure it. Through these procedures, you can obtain a condylar guidance and you can obtain a anterior guidance. This is amazing procedures. Of course, you can see the bended angle movement and you can see the direction of the movement and you can see the walking side and the balancing side. Directly, clearly, you can calculate it. After obtaining all of this condylar guidance and bended angle and anterior guidance, if you put in a number in the programs, you can obtain a very functional prosthesis like this. This is the very powerful effect of the digital technologies. And Even though you can make the digital articulation like this, some of our lab technicians still want to use the real articulator. At the time, never make the rear paceball transfer. Instead of the rear paceball, just fill the gaps. So print out it and then connect it. This is the exact same as your virtual space and real spaces. I called this is the AutoGate digital mountings. So in an AutoGate program, if you match the maxillary arch in some special plate, our program automatically fill the gap like this, and then after print out it, just attach it. Through this procedure, you can make the same status in a virtual, it means the digital space and analog space. Like this. So this yellow part is printing part. So just print out it and use the glue. If you connect it, it's the same location, patient hinge and maxillary arch side. It's very simple and very accurate paceball and mounting systems. And based upon it, we published the article about the jaw position, jaw location systems. What is the vast merit of the digital technology? That's the diagnosis. So even though it looks so complex and difficult, once after make the virtual patient, through that virtual patient, you can make the proper diagnosis and perfect treatment plan. And based upon that, do it. As a result, you can make the patient happiness like this. For patient lifetime smiles. What else? If you have some idea about the digital procedures, you can do a lot of the things, not only prosthetics, but also the surgery and more extensive surgeries. That's the Korean beer, called same names. How about this case? This young woman shows the gummy smile. So we need a crown lengthening procedures. But if we can do the minimally invasive surgery, yes, we can do that. So as a first step, make the virtual patient. And where is the ideal gingival line? Cement to enamel junction to 3 mm below. So go to the CBCT and find the cement to enamel junction, and after that make the future gingival lines, and then make the crown lengthening guide, and based upon it print out and put in a patient mouth, and based upon the future gingival line cut up the gingival like this, and use a very special chisel, KB1 chisel. Without the reflection, you can make the biologic width like this, and use a razor, trim it again. So this is minimally invasive crown lengthening procedures. There is no flap opening and suturings. 1 week later, you can see the very nice clinical result. Like this. How about the endodontic treatment? In a calcified canal, it's the same logic, implant guide surgery. So, through the CBCT, find the canal pathway and make the guide, and through the guide, you can make the root canal pathways. We call this is the endodontic guide, How about the transplantation? In a young patient, instead of the implant, we can make the third molar, transplant it. So through the CBCT, make the SDR files and do the virtual surgery like this. And after that, print out the third molar first and transplantation guide. Instead of the extraction of third molar, use a dummy third molar, make the preparation site first. And after that, extraction it and place it, fix it. It's a kind of the idea. How about the orthodontics? Why not? Make the bracket guide and place the bracket like this. This is the very small printout guide and use a wire. We can fix it. How about the orthokinetic field? As you can see in these pictures, this patient shows the facial deformities. Don't worry about it. Sterilization and do the virtual surgery. Program is this. This is the imagination. How you can make your imagination into the reality? Use a guide. So we made the saw guide and customized the plate screw hole first, and then through the customized plate, fix the bone segment. This is very objective surgical procedures, and when we compare the virtual surgery and real clinical result, it's almost the same. We called this system as a face guide. Not only cutting the bone, we can edit the bone. So we published the article. So this patient received some plastic surgery but lost the mandibular angle, and he wanted to recover the original situation. How we can do that? At that time, we can superimpose after surgery and before surgery status, and we can easily notice how much bone was cut off. So based upon this data, we can make the artificial mandibular angles and put in, and then we can recover the patient mandibular angles like this. So in my practice, I always use a virtual patient. So when I make the virtual patient, I use three datas. The first one, CT, and second one is the STL files. It means digital model files. And third one is the facial scanning files. So recently, we made the new machines. So through this machine, we can obtain three kinds of the data simultaneously through the one machines. So we have a 20 by 20 large FOV CBCT. And second one, as you can see this part, this CBCT has a camera, 3D camera. So through this camera, we can obtain a facial scanning files. And third one, not only human CBCT scanning, but also impression scanning, we can obtain STL files. And fourth one, through the powerful software AutoGate, we can do the virtual surgeries. So this is the very strange things, impression scanning. Let me briefly introduce what is the impression scanning. Its meaning simple. It's a conventional impression technique. So just take an impression, and after that, instead of the stone pouring, just put in an impression into the CBCT machine. And after that, CBCT scanning. And then you're gonna obtain a STL files. Look at this. This is the impression material. And use a mouse. If you drag it and flip it, you're gonna obtain a models. This is the new technologies. So when you talk about the STL files, we can use the three kind of the way. The first one, take the conventional impression and stone pouring it and use a model scanner you can obtain the model files. And second one, use an intraoral scanner. Also, you can obtain STL files. And recently, I use this impression scanning mode. It is very powerful into the implant dentistry. Let me show you one clinical case, upper and lower fully edentulous case, and place the implants. And when I make the second provisional restoration, I do the modelless provisional restoration. So connecting the impression coping like this and take an impression, and instead of the stone pouring, use the impression scanning. I obtain a digital model, upper jaw like this, also lower jaw, same, and then I obtain a bite and flip it and merge it, upper jaw and lower jaw. So without stone pouring, I mount it and match the library, and after that, draw the provisional restoration and customize the abutment and put in a dynamic occlusion status, and then connecting the provisional customized abutment and put in a PMMA crown. This is the modelless procedure. So not only intraoral scanner can do the modelless, but also impression scan mode can do the modelless procedures. And through this machine, we can obtain a whole digital data, and we can make the digital virtual patient. But we need a fifth element. Fifth element means digital laboratories. So let me introduce our digital laboratory. We have a very nice, very awesome digital laboratory. So we have a AutoGate diagnostic part, and we have a CAD design part, and also we have a virtual orthodontic programming part. And after design all of the prosthetics or appliances through the milling machine and through the printer, we can manufacturing it. But still, digital dentistry and the digital technology is advanced. Still, we need the analog part. So we have to check the adaptation or polish the surface, some things. So in this era, it's not a fully digital dentistry era. Still, we have to mix digital dentistry and analog dentistry. So after my presentation, a lot of you peers, wow, that is the really awesome and amazing system. But you worry about the large FOB CBCTs. It means I know some of country has a very strict radiation regulation. So even though you want to use this CBCT machine, because of the regulation, you cannot use it. I understand that situation. And another problem is the price. It is very expensive. So recently I developed a new solution. This is the good news for you. So that is the one-shot facial scanning and facial scan body system. So what is the one-shot facial scanning? This is the new machines. So it has a 3 camera and simultaneously obtain a 3 image of the patient and immediately reconstruct the 3D virtual patient. So through this one-shot facial scanner, even though you don't have the CBCT or you already have the small FOB CBCT, at the time you can make the virtual patient and you can enjoy the digital oral design procedures. So let me introduce my son, Ian, and how I can use the virtual patient of my son. Let me introduce my son. His English name is Ian. He's 19 years old. So 1 week ago, suddenly he complained about the right jaw pains. So how I can use the virtual patient? This. So as you can see in these pictures, I attached some sticker. It's a paper sticker. So I attach it to the arbitrary hinge like this, and use a facial scan body. I place the maxillary jaw like this. So there is no CBCT. Even though you have no CBCT, you can make the virtual patient like this. And then through this procedure, I have a lot of the articulator. Usually I use the cabo articulator. So match the arbitrary hinge and virtual articulator like this. This is the pasteboard. So pasteboard transferring is finished. Through this data, I can analyze it. So when I analyze the EN situation, this is the maximum intercourse patient, and this is the painful jaw position at the time. Can you see this one? Condyle position is a little bit different. It means lateral discal tissue is pressed. That's why he feels some pains, and as a result, jaw is a little bit shifted. This is a mandibular position indicator. So three-dimensionally, you can analyze the jaw position, not only arch position, but also you can analyze the condyle position like this. What is the treatment options? Put in some appliance. That's the anterior deprogrammer or CR stabilizing systems. Anyway, use the three-dimensional technology. In an old era, you cannot see the condyle position, but through the digital technology, you can see the condyle position movement like this. Now let me show you another case. So in a prosthetic stage, it means when patients don't need the implant surgery. At the time, we don't need the bone information. So in a prosthetic procedure, we can use without the radiation. We can make the virtual patient like this. So as you can see in these pictures, her dentition is a little bit ugly. So she don't want to receive the orthodontics. She want to fix through the prosthetics. So make the oral designs like this. So loading the new tooth and simulation it, and after that put out this data. Put out this data means I can put out the two data like this. The first one is the maxillary arch, and second one is my future maxillary incisor position. So my lab technician will receive these two data from me, and based upon a maxillary central incisor, he will draw the 6 maxillary anterior tooth, and after that he will send provisional restorations, and through that I can put in a restoration like this. We can collect the tooth arrangement, tooth size, and tooth leveling, and incisor levels like this. So you can see this system maybe end of this year, some things. Is it good? This quote spoken by the Da Vinci, and this is my clinical theme. So he who loves practice without theory is like a sailor who boards ship without rudder and compass. And I love this sentence, never knows where he may cast. It's exactly same as our daily practice situation. So we need a rudder and compass in our daily practice. So in my opinion, what is the rudder and compass? That is the proper diagnosis. Through the proper diagnosis, you can see the final goal. Finally, you can see the final goal. So what is the next step? Go to the final goal. Never go to the dangerous zone. That's why I made the R2Gate digital oral design system. Basically, when you talk about the R2Gate digital oral design system, key factor is the virtual patient. And finally, I made the all of the solution. Even though you have CVCT or not, and even though you have the large FOV CVCT or small FOV CVCT, you can enjoy the R2Gate digital oral designs. It's good, right? So when I developed some solutions, I always keep in mind these things. I always find the oldest but goodest things first, and then if I can change these oldest but goodest things into the digital ways, that is the true digital ways. I say that is the digital thinking ways. Unfortunately, recently some of the young dentists, they only focus on some technology and some skills. But if that kind of the skill is not good for the nice clinical result, that is just a skill. We have to keep in mind these things. All this what good is should have to be changed into the digital ways. So Wikipedia say digital, when we use the digital dentistry, it is very helpful. But unfortunately, also this is the private opinion. Unfortunately, recently a lot of the company advertise about the restorative things. That's why when we meet the CAD/CAM technologies, we feel some headaches. Because a lot of the companies say like this: if you purchase our CAD/CAM system and if you purchase our scanner, you don't need the conventional impression, and you can design the prosthetics by yourself, and you can manufacture the prosthetics by yourself. It's cool. I agree with them, but we have to think about our lifestyle. Really, do you want design the prosthetics by yourself and manufacturing it, and you have to work the porcelain works? It is very worthy, but I don't want that kind of the lifestyles. So DIY without the lab technician, it's almost impossible to normal dentist. So DIY to me seems like a die. So as a dentist, instead of the manufacturing, design some things, we have to focus on a diagnosis. So especially when you use the digital technology in a diagnostic field, it is very useful. That's why I love the virtual patients. But when you talk about the diagnosis, it is very difficult things. Why? We have insufficient information due to the fog, and we don't know over the bridge situation. That's why we feel some scare. But think about that. If you know the proper information, if you know the sufficient information over the bridge, we don't need the guess. We don't need the assumption. Right? So in our daily practice, sometimes we just send the cast to the laboratory without any information and just order to them. You have to make the nice, beautiful, and functional prosthesis. Is it possible? So we have to send the information. Condyle position, center of the face, ideal occlusal plane, midlines. And based upon that, finally, our lab technician can make the prosthesis. At the time, all of the information should have to come from the patient, our individual patient information. So, uncertainty, opposite word, is the information. And virtual patient is the bank of the informations. Through this way, we can make the patient function and aesthetics. This is our ultimate goal as a dentist, right? So today's my presentation is some kind of the introduction about digital dentistry. So the rest of our great speaker will introduce some specific skills, and they will show the more beautiful clinical cases. But anyway, digital dentistry is not a hype. It's a real. But when you think about the digital dentistry, also digital dentistry is not a magic. It's a science. So always go back to the basic and always find the oldest but goodest things, and please that change into the digital ways. Thank you for your kind attention, and sorry for my ugly English. And if you have any questions or suggestion or comments, please send me the email. And if possible, we will make the short film continuously and upload the YouTube. So see you next time. Please safe in COVID-19. Thank you.